spine is a very delicate structure to begin with. Essentially, when we are very young, as in our mother's tummy, the spine forms from the same tissues. So all the tissues are formed from the one tissue, and then it differentiates or divides into different tissues like bone, ligaments, joints, and nerves. So everything is very close together. So when we're doing the surgery, the distances between these important structures are very minimal. As a result, it's a delicate surgery. So in the old days, we had to open up the spine to actually look at what the pathology was and address it. Even today, for some type of problems, we have to do that. But for a lot of degenerative spine problems, we can address these problems through small incisions and through tubes and through channels that the body provides us to have access to the spine. Here's a model of the spine, and the patient is lying on their side when we approach it. And so we come through the abdominal wall and essentially make that pathway through the abdominal space behind where the abdominal contents live, and access the space through what's called retroperitoneum. And then we go through the muscle after we map the plexus, nerve plexus, by that sophisticated electrical testing that we do on these patients, and then access the space. And it's a very powerful technique to open up the foramen and realign the spine in deformity cases. The typical spinal pathologies and conditions we treat with minimally invasive spine surgery could range from something relatively simple as a herniated disc in a young person, or spinal stenosis in perhaps a little bit older person, or reconstruction with fusion in an elderly individual with a complex spine deformity. So the advantages of minimally invasive spine surgery is that you go through small incisions. So when the skin heals, the result is cosmetically very favorable. For example, the incisions in the area of belly, then people can still wear their bathing suits and not have to worry about big scars. The blood loss is less because you're going through tissues, through retractors, so it's sort of the pressure from the retractors controls the bleeders. And the healing is quicker. These surgeries are done as outpatient because they don't have to spend the night because of a lot less pain compared to what it is traditionally. So the recovery is faster, people can move around faster, they can get back to doing their activities of daily living faster and return to work faster. And they need less pain medication post-operatively, which helps them participate in other activities on a day-to-day basis.